All right, good evening, everybody. Sorry for the delay. I'd like to call to order the Wednesday, October 25th, 2023 CMH full board meeting. Please rise for the pledge.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next, we will have Antoinette read our mission statement.
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next is adoption of the agenda. I'll take a motion to adopt.
Support.
Motion from Antoinette, support from Wayne. Questions, comments on the agenda? Seeing and hearing none, all in favor say aye. Aye. All opposed? The agenda is adopted. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Anybody from the public? Nobody's running to the podium. All right, we will close the first hearing of the public. There is another before the end of the meeting. And we'll move on to item 5, approval of the minutes of the regular meeting of the CMH full board held on Wednesday, September 27th, 2023. I'll take a motion to adopt those minutes.
Support.
Motion from Donna, support from
No.
Dana. Nick has a question.
I was just going to say, on 5A and 6A, I'd like to be recorded as abstaining because I missed the meeting.
Thank you, Nick. Any other comments, questions on minutes? Okay, all in favor say aye. Aye. All opposed? Motion passes with Nick abstaining. Next, we'll move on to item 6, approval of standing committee meeting minutes from the CMH Board Program and Budget Committee held on Wednesday, October 11th, 2023. I'll take a motion to adopt. Or approve. Motion from Lori, support from Selena. Questions, comments on the minutes? Okay, all in favor say aye. Aye. All opposed? Minutes are adopted with Nick abstaining on that item as well. Next, we'll move on to item 7. I will take a motion for items 7A and B. Both were discussed at program and budget. The first is AMSR outpatient manuals in the amount of $24,650, and the second is OST master service agreement, option number 2 with multi-year engagement of $9,500 per year. Motion from Antoinette, support from Nick. Comments, questions on either of those two items? Seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next, we'll move on to item 7C. This was discussed at program and budget as well, but the dollar amount has changed, so I'm taking that item separately because of that. So I will take a motion to renew the lease maintenance agreement with Applied Innovation with the rate change, which is an increase of about $250 a month or $3,000 annually. Motion from Dana, support from Antoinette. Did board members have questions or comments on this item? Okay, seeing and hearing none, all in favor say aye. Aye. All opposed? Motion passes. All right, we'll move on to item 8, receive and file. No items there. Resolutions, item 9, no resolutions tonight. Next, we'll move on to item 10, the voucher listings. I'll take a motion to pay the bills. Motion from Megan, support from Selena. Questions, comments on the bills? Okay, seeing and hearing none, all in favor say aye.
Aye.
Aye. All opposed? Bills are paid. And with that, we are already on to the CFO report with Ken. Ken, the floor is yours.
Good evening and thank you. That was record time to the CFO update.
Antoinette and I have been here since 2:45, so we are ready to rock and roll tonight. Percent accordingly, Ken. No, I'm kidding.
I've been so warned. I'm going to jump right into the report with a couple of highlights. Page 2, we can start seeing some of the things we've been talking about with revenue and eligibles. If you look at the eligibles chart, probably need to tweak this a little bit, but you can actually see the top of the blue bar in August is down a little bit as expected with our eligibles. So we continue to look at that, but again, that's tracked and expected. At the top in our revenue, you can see while our eligibles went down slightly, expecting revenue to go up slightly because of the PHP rate amendments that were pushed through at the end of the year. We talked about those at the last meeting. So I just wanted to highlight those because they're kind of in opposite directions, but there's good reason for that. Page 3 and 4, I don't think there's anything unusual compared to prior months. Page 5, I'll highlight our CCBHC Medicaid surplus of roughly $9 million and our CCBHC Healthy Michigan surplus about $2.5 million. So that's good news. That number's trending up. The interim FSR, which is due November 10th, should give us a really good look at our final numbers and things for that. So I'll cover year-end stuff here in a little bit, but I did adjust the risk reserve. Last month I noticed it was more of an estimated number. 43,510 is what we expect to end this year at with our ISF, so that's fully funded. Page 6, our CCBHC non-Medicaid deficit continues to grow. We effectively cover that with general fund, as you can see below that, so we have sufficient surplus to cover that. But those are folks who don't have Medicaid or Healthy Michigan that we have to, as part of our CCBHC, provide service to them. The last thing on the report, page 8, I just wanted to highlight, we have a negative number there, second row down in the savings and lapse. What that represents is we actually, so one of the items I reported on previously was our CCBHC withhold. I think the last time I spoke about it, we were arguing our data with the state, ultimately because of Karen Slattery's effort, who's on our clinical team, and others were able to successfully argue that. So not only get the $1 million back that we thought we might lose, but because of a reallocation, we got this extra $194,000 that's represented there. So big kudos to the team there, and a nice financial win. That's it for the report. If there's any questions on the report, I do have a few more items, but if there's anything
Any
specific to that.
questions for Ken at the moment?
Okay.
Okay.
I'm going to cover my usual 3 items I think I've had. We continue to have a dispute over state inpatient as it pertains to my HealthLink individuals. Have not heard anything on that. That continues to be an outstanding item. The Internal Service Fund, again, as far as we're concerned, this is properly reported and in line with our contract, but also haven't heard any further communication on that. The $19 for the MAT service, I think we're waiting on some documentation from the state, which, Dave, correct me if I'm wrong, we have not seen yet, so that continues to be ongoing. But it is moving and there's dialogue there. So can't speak to that. We do have our year end coming up. We have 2 different audits going on, our financial statement audit and our compliance audit, 2 separate firms. Our compliance auditors won't come until the spring after the final FSR is done, but we are working with our financial statements auditors on that work. Next month I will be bringing a contract extension for our compliance auditors going forward. But right now we're focused on closing the books, closing grants, and that kind of stuff. So I'm hoping at the next meeting we can come with some preliminary final numbers like we normally would for the board to look at. That's all I have.
Thanks, Ken. Any-
Questions?
Nick, go ahead.
I'm having trouble hearing you. The Medicaid reserve allowed did not change? And not in terms of our money, but what the state allows us to carry forward.
It changed in 21. Our contract language changed, and our interpretation of that supports adding 7.5% of our revenue per year to the fund, as opposed to capping it at 7.5% per year. So the language changed, and that's what, as Richard spoke to,
So we're allowed to carry more forward.
that is our position right now. And we're waiting to hear from the state on the back and forth we've had with that, but that's how we've reported it.
State is not in agreement yet.
Correct. Yeah, it's just
Just dead air.
They haven't responded, is what you're saying?
at some point when we do the final FSR, we did it last year, there's gonna have to be the template itself isn't designed correctly based on the contract language, so there is some additional dialogue that's gonna have to be.
Go ahead,
I
Dave.
apologize, but through the chair, we brought the issue up. Richard gave it to them in detail in writing before we signed the 24 PHP agreement, and they didn't change any of the language. They kept it in there even. So I think it just further supports our argument that when we're able to, we can continue to use add it per year as opposed to kind of a lifetime cap of the 7.5%.
Well, we've been trying to increase the cap, arguing that the pandemic's costs
Right.
further ahead, and so we're
Yeah,
making
we're coming up
progress.
to, a lot of changes, and our risk and everything will go up. So it just makes so much more sense for the system to be able to retain more funds to help manage through that. But I've not heard anything back on that at all.
And I'll add some context on what Dave said too. Our auditors in fiscal 22, we're looking at the contract language, and because the PHP contract language continued to support that position, they ultimately became comfortable with it. And additionally, the numbers we have here are actually supported by an independent actuary analysis to come up with our balance, so, which is all consistent with the accounting standards and the federal regs and that kind of stuff. So we feel like we're in a really good position to support this
Thank you.
dollar.
Thanks, Nick. Any other board members with any other questions or comments? Okay,
Thanks, everybody.
thanks, Ken. Next, we'll move on to the CEO update.
Thank you. With apologies, my written report did not make it to the board ahead of this meeting. I had to be out of town unexpectedly over the weekend and just came back today. So I will provide that update. The couple of quick updates. Tomorrow is the fall event for our staff with the trunk or treat and a number of awards to help celebrate all of the good work that our staff does. Tomorrow, even though it's trunk or treat, there's an event at Lutz School, and we will be represented there. And you also have the Health and Wellness Fair on Saturday at Trinity, Utica, which I will be attending, perhaps with some other volunteers. But yeah, so we're out and about in the community quite a bit now. And if you recall, we shared the list of August, September, and October events that we've been out at. So those continue to increase. And we're trying very hard to get the word out. Things are going well with Airfoil and our marketing. And Tracy and I were interviewing for the communications supervisor position. We started those interviews today and hope to have them wrapped up by the end of the week. So, but more to come. Thank you.
Dave got the memo. I wanted to piggyback on the staff heading out into the community a little bit, and I want to thank Tracy and the team that came out on Saturday to New Baltimore to the Make a Difference Day. We've done this for a couple years now, and I just appreciate the staff. It's a Saturday in the fall, you know, everybody has stuff going on, so I appreciate our staff and Tracy again for getting a team out there for that. With that, we'll move on to a presentation from Rachel. Oh my gosh, Clinical Informatics Department presentation. I can say it. It's been a long day.
Make this short, I promise. Hi, everyone. So clinical informatics, like I said before, is the use of data to make sure that we are more data-driven. It's using what we collect on a daily basis and putting in the EMR systems to help us care for our patients better. My team, now I have a team, happy to say that, is consisted of one administrator and 2 coordinators. Our job consists of mitigating errors, and that means we review our data and we look at it closely to see what is it that we can make a change in the EMR system from something that was written in notes, was it typed in? Can we make this a radio button so that we can actually collect this data and use it moving forward? If we find that some 2 things look too close, look alike too much, then can we change one so that we're not confusing the people who are entering our data? We work closely with the IT and IS team with that part. The other part is we analyze available data. Dirty data in, dirty data out, right? Trash in, trash out. But I'm happy to say that over time we've learned to use our data correctly. So we can look at it and see there's a change here that shows too many people are getting hospitalized for a certain period of time. Let's look at this close enough to make a difference. Personally, that's my favorite thing because the whole point of our services is to stop things before they happen, right? It's to help the people that we're serving. It's not to wait until they're at a crisis or to say, oh, shoulda, coulda, woulda. So that's my most exciting part for my job. The other part is we collaborate with other departments. For example, we have a leadership dashboard that shows, I think that's in your chart. It shows, it's page 6, 7, and 8. It shows clients served over time. Of those served, how many are getting services over time? We look at utilization versus authorization. Are we authorizing too many units when people are only using 20 to 50%? Of those that we are authorizing, which department is not using enough? What provider is not using as many of the units as we've provided? And then you can use that data to go back to the providers and find out more about it. Is it because of staff? Is it because the person doesn't need as much? So how can we change how we serve people from the data we see? We also work with the quality team for our KPI reports. That's been a hot topic to try and serve people better, with KPI 2 being how fast we get when somebody reaches out to our services, how fast can we get to them, and working with the beauty of data is it brings everybody together, right? So it might be a report for quality, but over time it's okay, let's talk to the clinical team. What is it that is stopping how fast we get to the people into service? Let's talk to the IT team. Can we change the forms that we're filling out? And so bringing all the data together so that we can move forward. We've also worked with the finance team to look at overlapping claims, substance use disorder, SCD, to work with a person served just for their people. Network operations, I feel like I bother them every day. There's always a new data source to ask them for, to deal with them, to make sure that we are giving providers data as much as they are putting in data, because that's a big problem, right? Because I can put in whatever I'm putting in, but if I don't know what my case managers are putting in, then we're walking in blindly. So that's been one of the things we do as well. We also work with the medical team, Dr. Sapper, to give a medication list. This allows her to look at the meds that are prescribed per prescriber, per client, to see is this person on too many like what schedule drugs are they on? Is it too many? Can we change something? Is this person scheduling too many or too little, and helping her in that end. So our future goals and strategies are to make MCCMH more data-driven, to make our processes more efficient, to make sure that we allocate our resources properly and shorten wait times and get care faster to the people that need it. And use data to help our clients, to use our data to get potential health risks before they escalate, and to maintain the well-being of the people we serve. Any questions?
Thank you, Rachel. That was great.
Thanks.
Any questions before you go? Are there any questions for Rachel? I appreciate your pace. I just want to say, as a board member, this information and having this dashboard is incredibly helpful because it helps us tell the story of what our staff is doing and for the folks that we're serving. We can go and say, you know, this is the number of people that we served this month. I mean, it's not just a year or anything like that. I mean, it's really broken down here. And I personally appreciate that as somebody that's up and around Lansing all the time. I can have this handy and say, you know, this is what we're doing in Macomb. And we're tracking everything. And the data here is incredibly important to help with our message to back that up because numbers are incredibly important up that way. And when we show them this or we tell them this, I mean, this is fantastic. This is incredibly helpful. Thank you, Rachel.
You're welcome.
Anybody else? Okay, thank you. All right, before we get into reminders, I have a really quick story that I would like to share about one of our board members named Mark. It was the weekend, and Mark started his morning at an East Point Community Action Coalition coffee hour where he met with community members and talked about substance use prevention efforts. After the coffee hour, Mark headed out with his wife Karen and spent the day at an orchard with their grandchildren. As he was heading home, Mark noticed a few people standing around a person lying on the ground. Mark drove past and stopped. Mark looked at Karen and asked, "You have Narcan, right?" She replied that she did. Mark did a U-turn and ran up to the scene. One of the people standing there was on the phone with 911, and Mark said he would administer Narcan to the person on the ground. Mark kneeled down and checked their pulse. They had a pulse, but they were not breathing. Mark administered the Narcan intranasally. Moments later, the person gasped for air and started to breathe. EMS arrived and took over. Within minutes, the person's eyes were open and sitting up. They were then taken into the ambulance for further medical care. Mark has been delivering training on recognizing overdoses and administering naloxone since 2017. Since then, Mark has provided this training to over 6,000 people, likely saving many lives. It was not until this day that Mark was called to save a life with naloxone. Mark's favorite quote is, "It's better to have it and not need it than need it and not have it." Mark, thank you. Incredible story. Surprise. With that, do any board members have anything else they'd like to say, mention, add?
Mark, any comments?
Mark, you got anything? And make sure you turn your microphone on.
There we go. It actually works. I just, I tell people all the time in trainings, it's better to need it, to have it, not need it, than need it, not have it. And that was just proof. We just right place, right time. And when I got to the guy, he was dying. He had a very weak heartbeat and was not breathing at all. Everything had to fall right into place for me to be there right then. Like, we stopped at Myers before we went home, and I did see the guy afterwards. He lives right around the corner from me now, and he seems to be doing okay. So that's the main thing, is he's got another chance at life. So hopefully he'll get the help he needs and a happy life. So keep an eye on him.
That's great, Mark. Thank you. All right, couple reminders real quick.
I wanted to say something super quick.
Oh, go ahead.
Okay.
Make sure your microphone's on too.
Okay, so I just wanted to say really quick, I like to know what kinds of programs are out there, and I know you guys like to know that too. So I went to a fundraiser at Steffens Park in Fraser for an organization called No Resolve. And then I took the kids to that Chaos on Coleman, and every year they do, they raise funds for a certain nonprofit. And this year, their nonprofit was No Resolve. And I just thought it was funny that I saw them twice, close together. So I just wanted to let you guys know they're a 501c3 nonprofit dedicated to promoting mental health and preventing youth suicides through outreach, advocacy, and education. Their mission is to break down the silence, shame, and stigma surrounding mental health by providing adults and teens with tools and skills to help improve their overall well-being. They've been around for 15 years. They have reached 170,000 teens, and 86 cents of every dollar goes directly to their programming. I know they have a location where kids can kind of come and hang out and talk, and I just thought I'd never heard of them before, so I just thought it was nice to know that they were out there, and I wanted to share that with you guys.
Thank you, Dana. Any other board members with anything else to add? Okay. Program and budget for November will be Wednesday, the 8th, here at 6 p.m. The full board meeting will be on Tuesday, November 21st, instead of the normal Wednesday, because that is Thanksgiving week. And with that, we'll move on to hearing of the public.
Hi, I'm Angel Weiss. I'm a member of Crossroads Clubhouse, and Bruce is sorry that he can't be here tonight, so he sent me. First, I want to thank everyone for allowing us to go to Utah. We are leaving at 4 a.m. tomorrow morning. And the other thing is many members from the board and the staff came out to our open house in October, and we really want to thank everyone who attended and participated. The biggest part about our open house is the community outreach and to let our name get out there. Small dose. We raised some funds for our Thanksgiving and Christmas banquet, and this year we raised over $2,000. And so we wanted to thank everybody for coming out and for participating. And if you got a call, please come pick up your stuff.
Thank you. Anyone else from the public? Okay, we will close the hearing of the public, and I will take a motion to adjourn. Dana, Megan, all in favor? Aye. We are adjourned. Happy Halloween, everybody.